Name and position. My name is Dr. Ziad Farah, and I'm a consultant in rheumatology and general internal medicine. I also have a specialization in acute medicine as well. What made me choose to specialize in rheumatology? Well, rheumatology is a specialty that is very multi-system, and it involves looking after a patient as a whole, looking at multiple organs and how different elements of the body interact with each other. It involves a lot of analytical thinking and coming up with a diagnosis, almost being like a detective, for example. And what's really interesting about rheumatology is that the conditions themselves are fascinating, and the treatments that we have means that we can make a real difference to patients. What do I find most rewarding about my job? Well, I think one of the most rewarding aspects is getting patients better. It's particularly the case because in a lot of rheumatology conditions can be quite challenging to diagnose, and often I find that patients might have spent a long time trying different tests, seeing different people before I can pull it all together and offer them a diagnosis. And by getting the diagnosis right, it means that I can start the right treatment for them, and seeing them get better is by far the most satisfying aspect. I'm also very passionate about looking after patients in the acute setting, particularly making very quick life and death decisions in the emergency setting. And again, that experience and that feeling is very difficult to explain or describe to anyone who's not actually been in that place. Okay, so that question is, what do I value most about my patients? And what do my patients value most about me, and what do I value most about them? I think patients have often fed back to me that they value the time that I allow them to express how their condition and disease has affected their lives. And also the clarity that I provide when I describe to them why they feel what they're feeling or what the condition is, and explaining it to them in ways that they can understand. And what I value most about my patients, I suppose, is the trust that they put in me. Sometimes when it's the most vulnerable times they can be. And it is that trust that allows me in on certain aspects of their life that it's definitely a privilege to be able to treat patients in that context. What are the challenges of rheumatology? Well, I think the biggest challenge at the moment is probably resourcing and the number of rheumatologists out there. We know that many more patients are being identified as having rheumatological conditions, and certainly we know that there's a long waiting list for patients to access to doctors. And also, I suppose there are so many new treatments out there. Some of them are very expensive and considered high-cost drugs. So access of patients to these treatments can also be a challenge. So it is a very interesting time. There's a lot more recognition of rheumatology, but also many more treatments available. It's just about getting patients linked to the right diagnosis and treatment. That's the biggest challenge at the moment. So the next question is, which 3 adjectives would describe my profession? Well, I suppose the first thing I'd say is it's very exciting. It's never mundane, it's never predictable. It's always very interesting to hear patient stories and to know who the next patient is coming to my clinic. The other adjective is it's very stimulating. There's always more to learn. There's always new things out there, new research. There's always room for development. I suppose the last thing to say is that it's a very rewarding profession. It really is a privilege to be able to hear patients' problems, get them better, and have that relationship with patients.